Hello, good afternoon. This is Elias Tsakos broadcasting from Thessaloniki, Greece. I hope you're all listening okay. I'm just waiting to finalize some checks. Hello Maria. Hello, hi. Hi Dave, hi Liz. We're having quite a few participants. Hello everybody. Okay, it seems that I'm probably good to go. We're all going through difficult times. I thought I would communicate with you today and share my knowledge of the last few weeks. We're all very inexperienced in this, both physically, socially, and scientifically. So please excuse me if for many questions in the next few minutes I shouldn't be able to answer. I will try and give you some overviews, and I will try to give you an update of the situation regarding the epidemic. I will share my screen now. Okay. Can you see the first one of my slides? Okay. COVID-19, fertility care and fertility tourism implications. I would like to thank my team for organizing and preparing this talk, and in particular Maria, who is on the other line, trying to coordinate all the views and all the questions today. It's been an absolute nightmare for all of us. None of us, maybe 3 months ago, when we were celebrating Christmas and New Year, we could ever think that 3 months down the line we would be locked in our homes, not being able to work, not being able to see our loved ones, not being able to care for our patients. However, I think that the world has responded quite well in the coronavirus epidemic. And although we've been taken by surprise, I think now the world is taking its own back. Although there's about 2 billion locked in at the moment, it seems that every day all over the world, this battle is being fought, and we're winning. So I will try to give you some data, simply because now I'm sure that you're all over the internet all the time, and it's very difficult to distinguish and differentiate what's reliable and what's not. This presentation initially was designed for our patients, but then we thought that it was very difficult to ensure that it was only our patients listening in. So now it's open to some potential patients, some colleagues, some collaborators all over the world, from Australia to Canada, the US, and of course England and Europe are listening in, and thank you so much for doing this. So I will try to give you some scientific data, and I will try to give you some evidence at the moment of what's going on, in particular with regards to the fertility treatment, the fertility care, the fertility tourism, and overall the medical aspects of coronavirus. My talk is about 25 minutes, and then following this, we should be able to take some questions for another 20 minutes. So coronavirus is the equivalent to SARS-CoV-2. So this is the name of the virus. COVID-19 is the name of the disease. Virus is not always causing a disease, and of course, this is something we need to differentiate. Everything started in China at the end of 2019, and hence the name of the disease of COVID-19, which is short of 2019. About 2.5 months after the initial case, that was declared a pandemia by the World Health Organization. Pandemia is a disease which is widespread all over the world, And as far as I'm aware, there's about 200 nations at the moment declaring that they have the presence of the virus. I wouldn't like you to, I mean, part of my talk will focus on the fact that we should be, of course, very much aware of what's going on, but we should not be awfully worried. We should be listening to what our authorities are telling us to do. We should be taking all our measures to protect ourselves, our patients, our relatives, the society. But on the other hand, this is a pandemic, and there's recent pandemics as well. I mean, there was the flu pandemic in 2009. I think most people are not aware of that. And of course, there's an ongoing pandemic of HIV at the moment, which is killing annually, if I remember correctly, about 500,000 people. So the world, although we were taken a little bit by surprise, overall, the medical community were not totally unaware of pandemics and how to handle them. This is one of the maps that are available at the moment in the world, in which you can see the day-to-day, the hour-to-hour update of the pandemic. So as you can see, this is data from yesterday evening. So there's about 1.8 million, it could well be 2 million at the moment, of cases in the world. And there's about 115,000 deaths in the world. And here you can see the map distribution, which is clearly showing that Europe and Asia, of course, it began in Asia, and now it's mostly in Europe and North America. And of course, you can click by country and find out. I was speaking to a lovely colleague of mine in Ireland yesterday, and she asked me about the situation in Greece. So it's very easy to see what's going on by clicking on the map and finding out for yourselves what's going on in your country, in a country that you're interested in. So for example, in Greece at the moment, we have just over 2,000 recorded cases of COVID-19 disease. And I repeat that this is a disease, these are the carriers developing a disease. And we've had 98 deaths so far. So by doing so, you can find out for yourselves what's going on in every country. I mentioned Greece because, of course, this is where we're based. This is where Embryo Clinic is. This is where most of you are interested to know what's going on with possible fertility treatment. So I'm in a fortunate situation to mention that Greece is at the moment a global example of successfully treating the pandemic. Now, this is a national distribution of the cases of the world, and as you can see, the US are leading this unfortunate race with just over 500,000 cases, and of course, Italy and Spain that we've been listening in the news have been hit quite badly. And here we could see different other countries as well. So the world is acquiring data, and this data is very important for us to draw conclusions and to alter our practice and to define the new norm that we have to work towards. This is a national diagram for Greece. You can see that there's a very slow, steady increase of unfortunate deaths. But this is only 98 at the moment, and the overall cases, they seem to be going down with only about 30 new cases yesterday on a daily basis. Now, Greece has been a surprise, and a surprise to most people, especially in view of the fact that we seem to have been hit less severely by the virus, and we seem to have managed quite sufficiently in terms of altering our everyday practice in order to battle that. It has been described as the Great Greek Anomaly, because indeed, the global scientific community cannot exactly explain why this is happening and why Greece seems to be one of the safest places on earth with regards to the COVID-19. I have been here for the last couple of months, so I do have experience of why this happened. I think one of the factors was the fact that very quickly after the first or second case, and if I remember correctly, before the first death, there was a complete lockdown. There was a huge public and the governmental input into our everyday practices, and there was a lot of tracing, a lot of one-to-one management of every case, and hence there was an absolute limit to the overall number of cases. So per million of people in Greece at the moment, we have the lowest deaths, as far as I know, in Europe, with only 8 deaths per million. This compares very favorably to even Germany with the amazing resources. We've both heard about the 25,000 beds in intensive care unit and so forth. Netherlands, France, Italy, and Spain, they do suffer a huge number of deaths per million people. And of course, this has hit the headlines. The Guardian yesterday wrote that Greece is beating coronavirus despite a decade of debt. So we can all see that now there's going to be a lot of experience springing out from individualized nations' experience in dealing with the plague, with the modern plague. And even Boris Johnson, who we all know that he's very well versed into the Greek history and into the Greek culture. His ancient Greek hero, who's no one else but Pericles of ancient Athens. He has given some examples of how to treat a plague, how to treat a pandemic. Now, this is a very interesting diagram about Greece that is very clearly demonstrating that we seem to have been over the curve, and we seem to be heading towards a time in which all the measures will start to slowly being released. Now, there's a new norm in our lives, and this will influence greatly the after-COVID era. There's no areas, there's no domains in our everyday life that hasn't been affected by this epidemic with regards to health, work, social life, psychology, civilization, politics, relationships, and economy. So it's very early to draw any conclusions, so I can only touch upon the health consequences at the moment. As most of you probably know, in our practice here at Ebro Clinic, we also manage a big gynae and obstetric service, and also we have a breast center, and also we do care for cancer patients. So there's been new protocols instituted with regards to how we handle appointments, how we do not allow accompanying persons or children at the moment, and until the end of this month, until the 27th of April, when the new regulations are expected to come out. We're only caring for emergency visits, following very careful scrutiny on the phone as to what is classed emergency and what's not. And of course, we're all here. However, we're taking amazing precautions with regards to protection of the patients and protection of staff. Staff protection includes a lot of measures, a lot of personal protection equipment. I had to take all of mine off because I looked really funny on it. When we're dealing with patients, we do have to take great care because, as you all know, medical professionals and hospital staff, we're all at very high risk of contracting and distributing the virus. Now, most of you, of course, would be either pregnant at the moment. I'm very lucky to report that we had quite a few successful fertility treatments just before the lockdown, and I would like to say hi to all our pregnant patients all over the world, in particular last 3 cases in the UK. Hi, and I hope pregnancy is continuing well, as Maria is telling me you're all doing very, very wonderful, from the northeast of England to the southwest, and of course to Wales. So pregnancy, delivery, and breastfeeding. There was a huge discussion as to what is the effect of the virus and of the disease, the potential of the disease on pregnancy, delivery, and breastfeeding. Because of this uncertainty, the European and the American Societies of Reproductive Medicine, and of course the British Fertility Society, they called possibly about a month ago, very early on, for all fertility clinics to close and to discontinue any treatment that is that was planned. So we stopped planning or scheduling any treatments. So we just finished some of our cases that were underway and they couldn't be cancelled. So at the moment, we can only care for our emergency IVF cases with regards to fertility preservation for oncology patients, and all the other treatments have been paused. How long for, I don't know, but we can discuss about it a little bit further down the line. Now, part of the reason, of course, was the social distancing. So they had to lock people down. So having fertility patients visiting clinics and having tests and so forth wasn't exactly what the governments and the officials they wished for. And also they wanted to leave some space for the NHS systems in our countries in order to be able to care for any potential emergencies and so forth. However, there was also fear with regards to the unknown effect of pregnancy, delivery, and breastfeeding. Now, thankfully, we have very good reports so far. I stress that these are preliminary reports, and they may well change over the next few weeks. However, until now, it seems that the disease severity in pregnancy and delivery matches non-pregnant individuals, bearing in mind that the majority of our pregnant ladies are younger and generally healthy. There's been no maternal deaths, to my knowledge, that have been reported. And of course, many women have been asymptomatic and negative to triage, negative to questioning with regards to risk factors of contracting the coronavirus. However, there's been talks about the possible need for universal screening and testing prior to admission to labor. I understand that in the UK now there's a huge move towards universal asymptomatic testing, and I believe that the aim is very soon to achieve the mark of 100,000 tests per day. Until now, there's no particular evidence on vertical transmission of coronavirus in pregnancy and childbirth. So in other words, there's no evidence that the coronavirus passes the placenta into the fetus. However, in my opinion, I think, yes, indeed, there's a very low chance, but this cannot be ruled out completely, and we do have to keep an open eye on that. And until now, all the neonates, to my knowledge, that have been born to coronavirus positive mothers have been negative with regards to either PCR testing or antibody testing. And hence, breastfeeding is encouraged with appropriate protection, of course, for all pregnant ladies. So the evidence until now is very optimistic with regards to pregnancy, delivery, and breastfeeding. However, we don't have any data on the effect on the first trimester of pregnancy. We don't have any conclusive evidence on the effect of the fever on the fetus, and not just the virus itself. And sadly, we do have some evidence from the previous coronavirus, the SARS-CoV-1 and the MERS, where there have been reports of adverse effects on pregnancy. So clearly, more data is required. With regards to fertility and IVF, as you all know, all the clinics have paused now, all over Europe and in North America, and I understand in most places in the world. And we are now expecting all the new recommendations and the new data with regards to how to reopen and under what conditions and under what circumstances. I am in a happy position to report that with talks with our colleagues, with my colleagues in Greece, we're all preparing now for the next day. We're hoping to have some good news in the next 10 to 15 days as to the conditions under which we shall reopen. And of course, we are very well aware that there's a lot of patients now waiting to be treated. We're very well aware that there may be a lot of travel restrictions, especially for patients traveling from abroad. And those travel restrictions will not be lifted perhaps completely in the next couple of months. And therefore, we are all preparing for the next day in order to be able to provide safe and effective treatment as we've always done so far. So stay tuned. We should be able to post all the new guidelines very soon as we're in touch with the authorities with regards to those. One piece of good news is that we've had a notification from the Hellenic Authority of Human Reproduction stating that women who have postponed or who have cancelled their treatment because of coronavirus and they have reached the upper age limit of 50, they should be allowed to have treatment in the foreseeable future. So this is creating some priorities for us. And of course, we should give priorities to the couples or the women who have been through the system, have been tested, have done the initial pre-IVF testing and all that in order to streamline in the next few weeks. Now, with regards to surgery, the guideline at the moment is only to perform emergency surgery, and therefore we have paused all our activities with regards to standard gynae, breast surgery, fertility surgery, and even some cancer surgery has been postponed if this is classed that it could wait for a few weeks. Now, I will give you my 10 tips just before I finish as to how to battle the coronavirus epidemic. Those have been inspired by Hippocrates, of course, but also by Greek folk and Leonardo da Vinci. So I tried to be short and conclusive. So there you go. There's my tips. Stay at home and comply with your national guidelines. We have to trust our countries. We have to trust our national health systems and our governments because they know better than we do. And even if that sounds extreme, we do have to comply with it because, as Hippocrates said, extreme remedies are very appropriate for extreme diseases. And this pandemic is an extreme disease. Wash your hands often and avoid touching face, nose, and mouth. Simple standard advice, make sure you comply to that. And cleanliness makes you half royal, as we say in Greece. Drink plenty of fluids. As Leonardo da Vinci said, water is the driving force of all nature. So fluids is water, water, water. Avoid juices, alcohol, and anything toxic or too sugary. Improve your lifestyle, and that includes stress, nutrition, smoking, and alcohol. This may be a wonderful time to set the goals and stick to them. And let food be the medicine and medicine be thy food, according to Hippocrates. Exercise, we are allowed that. So we are allowed to walk or run or exercise once a day. So keep doing that because it seems that walking is man's best medicine. Boost your health and immune system and prioritize the importance of health. And this will prepare you for the fertility journey, which is perhaps a few weeks down the line. A wise man should consider that health is the greatest of human blessings, according to Hippocrates. Keep screen exposure to a minimum. Keep all the iPads, iPods, TVs, and all sorts at bay, if possible, because everything in excess is opposed by nature, according to Hippocrates. Start a new project and improve the natural healing force within you. Keep in touch with your medical team. I couldn't overstress that. We are here, all of our team are here, we haven't paused, we might be at home, we might be away from each other, we might be in different floors, but we're here, we're available to answer questions, to support, to Skype, to send you data, to get organized for the next day, and the next day is coming soon. And finally, time is the best medicine. This is going to pass, it may take a few weeks, it may take a few months, it will not take more than a year or a year and a half. There's a lot of wonderful news with regards to treatment, with regards to testing, antiviral treatments, and of course the jab, which is only around the corner. We believe it won't be longer than a year before it's available and before this is just a bad memory. So time is on our side and healing is a matter of time and also a matter of opportunity. And one last slide before I go. This has occurred in the last few weeks when we realized that being a doctor or being in the medical profession is not just about saving lives, it's not just about creating lives, it's about saving hope as well. And there is hope, and make sure we just hang on to that. Thank you all very much. It's been amazing. I'm sorry I took a little bit longer than planned. It's been now 30 minutes and I'm ready and free for questions for the next 15 minutes or so. Now, I have an anonymous attendee asking question, what are the views on IVF and BMI, and what are the links between these, and how can females improve their fertility? Do supplements help? Indeed, there is a connection between IVF and BMI. Indeed, there's a connection between BMI and general health, and in particular with coronavirus epidemic as well. We've all seen that high BMI may be an adverse factor with regards to severe disease. So this is a wonderful time to address that if you are over the normal BMI. And this is the time to find a way to battle that, either by contacting a nutritionist or a dietitian, or by finding some sort of self-improvement programs that would help you achieve the goal. BMI is linked with less success through IVF, with higher pregnancy complications and so forth. And of course, we would like to optimize that before we embark on fertility treatment and IVF. Could you give us some idea of when you would be able to treat a UK patient that had cancelled IVF in the UK, but for who treatment is urgent, given age and diminished ovarian reserve? Yes, any patient who would like to be streamlined after the end of the lockdown, we would ask them to contact our medical team, our support team, our coordinators. We can look into the files, we can prepare the registration, we can offer Skype consultations and so forth in order to be ready for the next day. As you all know, if someone decides to have IVF today, even if they go private, even if there's no waiting list, there's a good 6 to 8 weeks before they're good to go. So perhaps this downtime may be the best time to take advantage of this opportunity and get prepared. Are we accepting new consultations? Of course we are. Please contact the clinic on info@embryoclinic.eu. And although this is our Easter week in Greece, we're working flat out, supporting our existing patients and also communicating and guiding new ones. So by all means, send an email and you should be looked into as soon as possible. If things with the pandemic don't get better soon, is there any chance to allow patients make decision about fertility treatment continuation entirely themselves? Are the ASRM, EBCOG recommendations binding? Well, they are binding to a certain extent. I mean, there's a lot of talks. I think the Americans, they seem to be very active at the moment. They seem to be a little bit, I would say, more active than we are in Europe. There's a lot of anger, a lot of frustration. There's a lot of talks, a lot of discussions all over the globe. I would say they are binding, yes. We are bound by that because we do need to have some more data. We need to have some guidelines. We cannot, as clinics, as fertility clinics and as individual doctors or even teams, we cannot take the responsibility of designing our own guidelines. We do need some guidance. And I think it's a matter of time for that guidance to appear. I'm hoping, because I have had some individual discussions with a lot of members of committees, scientific committees. I mean, our own scientific committees in Greece, we've been discussing every day. I don't think it's very far from having some clear guidance as to how to reopen and when. And my hope is, especially for Greece, is that we should be able to start treating patients within May, within the month of May. Advice for eliminating cysts. Many women develop cysts due to IVF meds. This is individual question, depends on the situation, but if you do require an answer, by all means send us an email and we should be able to look into that. Results of screening tests that are only valid for a certain amount of time. What happens if these tests have passed the valid date? Yes, this is a problem. This is an issue. Unfortunately, they may need to be repeated. But as I say, I mean, it's not the regulation that's requiring us to do the tests. It's also medical good practice. So, for example, an AMH test could not be valid for more than a year, and this is common sense to most of us. Viral testing also could not be valid for 6 months, and this is for protection of for your protection, the protection of your offsprings, and of course the protection of fellow patients that are going through treatment. So we are obliged to be very strict with some of the testing, and in particular the viral testing. If I need an emergency cesarean for the safety of the baby and I have the virus, will they still perform it? Thanks. I think they would. I mean, I don't think that we should be changing our medical practice because of the viral epidemic. I mean, in my team, we've been delivering all week, this week and last week and every week. We have been triaging our patients. We have been testing for the virus on patients from areas of Greece which had the higher incidence of positive cases. Thankfully, they were all negative. We do have very clear guideline. If there is suspicion, we screen. At the moment, we screen with PCR testing and antibody testing at the same time. If someone is positive, then we refer them to a COVID referral center in order to have specialized care. And this is only done on the NHS. There's no such private center in Greece. And of course, the guidelines, they're just changing every week or every couple of weeks and so forth. So we're very vigilant because we need to protect the mothers, the unborn children, and of course, staff. Would you recommend any additional precautions when attending antenatal scans in the UK? Yes, I mean, can I tell you what we do here in Greece? I mean, our midwives, we are on daily contact with our pregnant patients, daily telephone contact, firstly. Secondly, if there's any suspicion, then we refer them for screening. And thankfully in Greece at the moment, we can do screening. We can do both PCR and antibody screening. Now, when they attend the clinic for outpatient scanning or appointments, then we ask them to, again, fill in a questionnaire, make sure that they're not high risk, make sure that they're not coming from a high risk areas, or they haven't traveled abroad in the last 2 weeks, they haven't been in touch with positive patients, and they haven't had any symptoms. We take their temperature twice. We ask them, provide them with masks, if they do, simple face masks if they don't have one. We ask them to wash their hands or use antiseptic, and we give them overshoes as well. And of course, we limit the clinic visit. We're auditing all of that. We're limiting the clinic to 30 minutes. So by doing all of that, we try to absolutely minimize the potential risk to them and to us. For patients who have had to postpone their treatment, will they be a priority when lockdown is lifted? Absolutely is the answer, yes, of course. Anyone who's through the system, I think most clinics would respect that. Definitely at Edinburgh Clinic, we give absolute priority to our existing patients, and in particular to patients who cancel their treatment, who had scheduled. I mean, we started counseling in the beginning of March. I think the last international patients we treated, they were just before the complete lockdown. And thankfully they were pregnant. So that's it. Now, the ones who have been cancelled, they will have absolute priority. And of course, we're hoping to be able to operate in August this year as well, contrary to what we have been doing during the last 20 years. And all of our staff have volunteered to give up their annual summer holidays in order to treat patients and make sure there's no backlog. Hi, I work as a dietitian specializing in fertility and diabetes. We're currently seeing that the diets of our patients are often becoming worse due to a variety of factors. I'm just thinking what will be the best platform to encourage patients to eat well to make sure they're ready for the treatment. There's a lot of platforms, there's a lot of online resources. Please send us an email. I mean, we consider dietitians as colleagues. You are our colleagues because you're helping optimize our patients' habits. And it's not just the diet and the weight, but it's also the nutrition. So by all means, send us an email and we should be able to exchange some data on platforms and some resources. Hello, doctor. We hope you and your family are well. Just want to thank you for helping us this time last year. We're now with our 16 weeks old baby and couldn't be happier. We hope to be returning to the clinic when this is over, as we would love a little brother or sister. By all means, we're going to be here for you. Thank you. Okay, I'm just being told that there's more questions. I'm very happy. I have plenty of time to take more questions. So please keep firing away. The regulations for traveling, I don't know is the answer. I have been in close contact with the Greek representatives in the tourist industry. And as you understand, there's a lot of talks as to what are going to be the conditions on which tourists should be able to come to Greece. Most of you would like to go to Greece on holiday anyway. And recently the Guardian again, and I think the Independent, they had an article as to, please vote which is the first place you would like to visit after the lockdown. And Greece came top of that. So I don't know what are going to be the regulations. One good thing about this epidemic is that it seems that people who have passed it, they seem to have some sort of immunity. We should be able to trace that through very simple tests and hopefully inexpensive tests. However, we don't have the data at the moment. But please keep in touch with the clinic, keep in touch with our coordinators and myself. Keep in touch with our websites on Embryo Clinic, Facebook, on my personal Facebook. As soon as we know, we should be able to publish that. My thoughts are that from July, maybe the latest, flights should be allowed and people should be able to start visiting. Would the COVID test be part of your screening once the lockout is over? The answer is possibly yes. Possibly yes. We're talking with the industry at the moment, and in particular with our microbiology colleagues at the university and in the private sector. We are looking into identifying what is the best way and when to check our patients. We're a little bit alarmed by a recent Lancet paper published last week, a few days ago, showing that asymptomatic patients with no symptoms who have been through surgery, elective surgery, even mild, moderate, and not so severe surgery like appendicectomy, they did have a lot of complications because associated with the fact that they were asymptomatic carriers of coronavirus. So in view of this, we are seriously looking into routinely screening for both the virus itself, so PCR and antibodies, a couple of days prior to surgery, or even 1 day prior to surgery, elective surgery, emergency surgery, and also IVF egg collections and so forth. So yes, we are seriously looking into that in order to eliminate the possibility of treating an asymptomatic carrier of the virus. However, we haven't had any guidelines. We're hoping that the guidelines would be clear. But even if they're not clear, we're hoping that we should be able to offer that at an inexpensive price. If you've missed some of it or half of it or most of it, please don't stress. It's going to be available free on our website. I'm sorry I can't read all the, some of the messages are very sentimental, so sorry I can't read it. Heartbeat scan on Friday. Okay, keep up the good work. North of England, keep it up. Okay, online appointments, yes, please send us, drop us an email and we should be able to accommodate that. That's no problem at all. I think it's probably time to call it a day. It's been amazing. Thank you so much. We've had a really large number of you attending. I'm very grateful. Thank you so much for listening in. Please stay tuned. We should be able to do that very soon with more updates, more questions. If you want any individualized one-to-one, please don't hesitate to contact us. In the meantime, please keep safe, keep healthy, keep optimistic. It's going to pass. It's going to be history soon, and we're going to be standing here. Take care.